So if you're looking for the quick fix, you can stop this video. Don't waste your time. Now, if you've been having some lower back pain and try to understand why you've been having this lower back pain, then stick around here because I will explain you one thing that might be causing your lower back pain. One thing you need to know and remember to get started with is that the spine needs to be able to rotate, side bend, flex, and extend. Okay, keep that in mind. Put this on this side. Second, every section of the body has different ability between either stability or mobility. This lower back here, guess what? Needs stability. You got it. You're on the way. Keep it up. Stay with me. Needs stability. This part here needs a bit more mobility. The thoracic cage brings mobility. Okay. Now, there's one thing important thing that you need to know is that the body always goes where it's the easiest to move. And if you have lack of mobility somewhere, which I will describe now, the body will compensate and go wherever it's easier. So, what I do see a lot because of poor posture that leads to poor breathing is that the thoracic cage is stiff, is stuck. Sometimes you will see people like rounding here, the chest collapsed, or it's either too open in like a military position, and that automatically will impact the diaphragm that cannot function properly, and will impact the rotation of the spine, side bending, this one here, and flexion and extension. So what I'm trying to say here, what I'm saying here is that, let's say when you try to bend to take something, if you try to flex to take something, or to do whatever you want, when you do these movements and it creates pain, it is most likely that this bad boy here is not doing the work, is not able to side bend, is not able to flex. So this is not opening, this is not rotating the way it should be. So what does the body do? Yes, it compensates. It goes on the lower back, and the lower back is working double, is working a lot more than it's supposed to be working. And guess what? As it's supposed to be stable and strong and stable, but now it's becoming more mobile because it has to do the work that this cannot do, pain starts creeping up. So what I want you to remember in this one now is don't look in a very small position. Is this where the pain is? Yeah, I'll stick around here. It's pretty easy, right? Doesn't deliver much. Zoom out, go in a macro vision. That good friend of mine will always say, go macro, zoom out, Jim, zoom out, Jim, zoom out. Yes, this is Adrian. He always says that to me. Hi, by the way. So what I'm trying to tell you now, and what I want you to know, is to have a look at the thoracic cage, and especially your breathing. Is your thoracic cage collapsed, meaning that you blocked on exhale, you cannot really inhale, or is it open too much and you blocked on inhale, you cannot exhale fully? Have a look at that. How does your rib cage feel? Do you have a good rotation without moving your lower back too much? Pay attention on those things and start doing the work. And obviously doing machines and linear exercise is not going to help. So I hope that was useful. If you want more information, feel free to DM me or contact me if you're serious about working on your body. Until then, I hope this video was helpful. Click on the button subscribe. And don't forget to like the video if you want to support the channel. There's a link to support me with a nice cup of coffee. Until then, keep it up and see you later.